When I was doing my undergrad here, like about 10 years ago, there wasn't as much of a discourse or an identification of mental health issues. So what's good is people are talking about it right now, but what we're ending up finding out, not just at McGill, but across North America, is there's a lot of people who are struggling with their psychological well-being and mental health. So the challenge has become for us how to support students and how to meet that demand that's out there. We've increased the amount of clinicians that we have on staff by about 30% over the last 5 years. We've spaced out sessions so we could have more students sort of enter our services, but that hasn't fixed issues on campus. So we moved to the collaborative care model to pull on peer support services that are available on campus, different branches of student services, because mental health issues are just not, they don't occur in isolation. So if I'm a student on campus and I'm interested in meeting with a clinician, then what I would do is I can either go in person or call up counseling service and book an appointment with a CCC. It's a client care clinician. What you do in that first appointment is it's 50 minutes long and you develop a wellness plan. And that's pulling on the different resources that we have available on campus. So some of those might be at counseling, such as individual therapy, group therapy, or workshops. We also have therapy assisted online. But also that wellness plan could also involve maybe a referral to connect with peers at the peer support center, at CAPS. A lot of students aren't aware that they have access to a lot of resources that can support their mental health. Mental health is more and more on people's minds, and that's a good thing because it's worth thinking about, it's worth paying attention to. So we have more and more students reaching out to come see a professional. But I think it's resulted with a lot of people, not just on campus, but across North America, feeling paralyzed that, well, I don't know what to do. I'm worried about doing more damage than good. So I won't necessarily reach out in these other more traditional naturalistic ways like exercise, connecting with friends, developing activities. And then they're waiting in a line to meet with a professional. And there's some studies out there that show that people actually get worse when they're waiting in line for a professional than not being in a line at all. One of the things that we've done in response to student concerns about wait lists is switching to the collaborative care model in order to try to be as accessible as possible.
So this was a report that was worked on by Student Services in collaboration with campus-wide partners. And there was 3 main recommendations that came out of the report. The first one was that student mental health needed to be addressed. And the second one was that the university really needed an expert to advise the provo in terms of where the campus needed to go in terms of health and wellness. What are the next steps? And the third recommendation was that the university strike a pan-university committee on health and wellness. The action plan that we put forward over the next 7 years is a $13 million plan. We'll be renovating a portion of our west wing. What we will have there is students who are experiencing, whether physical or mental distress, can come to what we're calling the Rossi Student Wellness Hub. They will be seen by a triage clinician or an access clinician who will help to triage them to the appropriate care. In addition to that, we will be embedding 10 what we're calling embedded wellness advisors into faculties. Part of this $13 million project will be to do an extensive mapping project of all of the resources on campus, as well as off campus, and we'll only have one website. And so that students will be able to go onto this one website. All of this information will be mapped onto that website in a very simplified way. So you can see that we're really growing and we're expanding to meet the needs of our students, but not just in terms of adding counselors. As Norm expressed, that across Canada, across North America, this has been tried. It's not working. So how do we provide the surround support for students in a way that makes sense and in a way where we can intervene early enough to where students don't get to a highly distressed level, and that's our goal.